How's the royal family? I pray that everyone is doing well. Well, my royal family, I got a number of emails from y'all. Thank you very much. I have did my research about coronavirus, and it ain't no joke. And when I was doing my research and on my journey, some people had the nerves to play it down, and this is serious. And then, when it comes to the royal family, some things we are the last to know. And I feel like I have a duty and responsibility towards my people. And so we all playing our part in this black media, and we report many things. So, y'all see the title? Yes, so far, 17 people have died from this coronavirus. And over in China, they said 17 years ago is when they had their last epidemic. That's what they're saying. All right, well, I found the video that I know that we all need to watch, but we're going to go on this journey. And you see here, they're going to go deeper into talking about symptoms and everything. We cannot take this light. This is when I talk about our duty and responsibility in dealing with our immediate situation. People that we can collectively reach out and touch in our individual households. So, we are in this flu season. I know this is man-made because based on the language that I'm hearing, most of these, when it comes to the flu season and all, it's man-made. I know my doctor, he was telling me that somewhere in a remote area of Japan, they make the flu virus in a lab. And he said they have a name for one each year. You know how they name these hurricanes. And he was all delighted to tell me he's Japanese. And he proceeded to tell me that, there was one year that, and it was astounding to them, that they made a strain that was identical. And they said that was the first time that had ever happened. And it was just quite fascinating to me because he always trying to push on me about getting a flu shot. That ain't going to happen. I'm going to continue to drink my tea. I'm saying this in the beginning because I'm going to be obedient towards the royal family. A while back, a few of y'all told me that y'all don't want me to put up videos talking about what we can take in order to keep our immune system build up and everything, that y'all would prefer that we do that behind the scenes. So I know some things that you can take. Many of us know about holistic medicine. So y'all can always email me and I'll make sure all those things are there. So, this is deep to me. I even went a little bit local too to see what's going on local, and you'll get a touch of that too as well. So let's get into this first video. 17 people died, more than 500 affected with coronavirus.
8:31, welcome back to BT. The number of new cases of coronavirus has risen sharply in China. Agencies now reporting the virus has killed as many as 17 people and infected more than 500. This comes as the first case of the virus has landed in the U.S. An American traveler who recently returned to the Seattle area after a trip to China is being closely watched by doctors in an isolation unit. He's said to be in satisfactory condition. The World Health Organization Organization will decide today if this is a global health crisis. And our Greg Harper is at YVR this morning. Greg, the airport is implementing measures in response to this outbreak.
That's right, Mary, and I've noticed one staff member here wearing a mask. I've noticed a number of travelers wearing masks as well, and some it's because of this outbreak. Others, it's because it's what they do, they say, when they arrive here at the airport. YVR is implementing new measures as a result of the coronavirus that is taking place there in China. The airport says it has been working with the Public Health Agency of Canada, and some of these new measures are being implemented sometime this week. These measures include messaging on arrivals screens and an additional health screening question to be added to the electronic border kiosks. Airport staff are also ready to quarantine travelers with any symptoms. While there are still many questions surrounding the new coronavirus, one local doctor believes it won't do the damage the deadly SARS virus caused in 2003.
SARS virus and this new Wuhan virus, they are both a family of viruses called the coronavirus, and they have some similarities, but until now, it looks like the severity of the new virus is less than the SARS virus.
So how are travelers feeling right now? Well, many have never heard of the virus. Others that have aren't concerned. Others do have some concern.
I just read about it yesterday, so I haven't read enough to be concerned just yet.
Yes, I'm currently planning to wear the N95 masks during the trip.
Where are you headed?
I'm going to Beijing.
No, I haven't
No concern.
been paying much attention to that news, and I've been in Cancun for the last week, and everything's been great. So I haven't thought anything of it.
Yeah, that's why we all have sanitizers attached to our luggage. So we're going to be sanitizing all the way.
No, we will take care to wash our hands and eat cooked food and stuff. So yeah, that's how but we already booked, so we plan to go, and we are not scared just for it.
And you know, many people will be traveling to China this week. It's for Chinese New Year, which of course starts on Saturday. Mary?
All right, thank you, Greg.
All right, my royal family. So, I don't want any pop-ups here. Okay, let's take this one down. So, they are worried about people traveling. This stuff is no joke, my royal family. This shit is real serious, and they even went as far as nailing down the store where they claim the virus came from, and they're claiming that when I was listening to the local news last night, that they claim it came from snakes. And I was like, what the fuck? I'm like, okay, I'm gonna have to find out what's going on, because that was messing up my psyche. So, there's a market that they nailed it down. And when you go in those Chinese markets over, they got them over here in the United States, and they be eating a lot of stuff that we don't eat. We've talked about it frequently on Lisa Cabrera's channel. I've went in there and seen live frogs, bust them in the head, skin them. I done seen them literally buy a square block of congealed blood from some animal, and let's not lose sight that these folks came from caves too. And I learned that through Lisa Cabrera, watching one of her videos one day a couple of years ago. Blew me back. I thought it was just Esau. I said, damn, I have a lot to learn. So, seeing the things that they eat, they can be having close contact. And I guess snake is part of their diet too as well. So anyway, I'm just kind of rambling on because this was like an eye-opening thing to me. So, I'm going to go local on y'all in just a bit here. We have Channel 2's news here. And I'll play this little short video about what's going on up here in Northern California. Then I have a much longer, deeper video to play for the royal family. Oops. Wait. Is that the one? No, that's not the one. I'll just tell y'all real quick. Up here in the Bay Area, there's people coming up here infected. And it's from the Asian race. And we need to stay out of these people's restaurants. We need to stay out of these people's stores. You know, I'm always mentioning this number 17. And it was speaking, and that didn't appear to me until this morning because I was researching it last night. And the number was put out so frequently. I seen 17 people killed. 17 years ago they had a SARS virus. Then I seen 17 million people could possibly be effective. And then the first video I seen 17 again. So our Father is speaking to the ones that are designate that number. It's like, get up off your hind parts. This ain't nothing to play with. So, anyhow, this video here that I'm going to play, it's about 15 minutes long, and I was really happy to get it so we can listen much deeper. And, you know, people want to downplay things, but when you see the enemy comes out like this, and they are infection disease experts and stuff, we need to pay close attention because they are concerned. You don't see these people often. So, let's get into this.
Anybody get that? Whoever would like to ask questions, start her up.
Can you guys start off and talk a little viruses, how it's spread, and what you know about it at this time? I mean, essentially our understanding is that it's originating in China, but there have been cases discovered elsewhere in Asia.
Sure, so maybe I can give you just a little bit of background information on coronaviruses to begin with. So these are a broad family of viruses that are actually named after their microscopic appearance. A corona looks like a crown. And there are, again, dozens of these. There's a few of them that are known to infect humans that largely cause relatively mild upper respiratory disease or common cold. And then more recently, we've had outbreaks of coronaviruses that can cause severe lower respiratory tract disease or pneumonia. So the first of these that we became acquainted with, you might remember, your viewers might remember SARS. They also came out of China back in 2003. More recently, we've had MERS, which is known as the Mid-East Respiratory Syndrome virus, which is coming out of the Arabian Peninsula. So now this is the third kind of novel coronavirus that we're having experience with that can cause severe lower respiratory tract disease. These typically spread from person to person via large droplets, respiratory droplets. So when somebody coughs or sneezes, it can be transmissible that way.
There were reports that this started at a food market. It is not a foodborne illness, though. This is something that spread just via the air.
Correct. So many of these coronaviruses have a natural reservoir in animals. And so we know that in certain instances they've been able to infect camels or cats or bats. And the original descriptions of this new coronavirus coming out of China to a food market where they had live animals that they would sell. So the hypothesis is that there may be an animal reservoir that is now transferred into humans.
So there has been at least one case here in the U.S., someone that had traveled to that area of China. What is your message to people here? I mean, how concerned do people need to be about this virus?
So maybe I'll turn to Dr. Lawler, who's our expert on global health security, and he might be appropriate to answer that question.
So I think right now the risk in the United States and in most countries outside of China is very low. The outbreak really seems to be concentrated in the city of Wuhan, which is in kind of central eastern China. And in the U.S., we should probably be much more worried about influenza and respiratory diseases that we know cause significant morbidity and mortality every year. So on an average year, 30,000 Americans die of influenza. So we've had one detected case of this new coronavirus in the U.S. So I think it's appropriate for folks to temper their alarm. But it is, I think, reason to be aware that we are vulnerable to emerging infections anywhere in the world. With modern transportation, you can be anywhere in the globe in 24 hours. And so, I think the good thing is it highlights that we've become much better at detecting these types of events. Our surveillance is much better than it was even in 2003 with SARS. And I think the fact that just a couple of weeks into the outbreak, we have a much better idea of what the pathogen is. We have systems already in place that are doing surveillance and detection and tracking. And so I think we're well ahead of where we have been with previous outbreaks. But again, this is unfortunately something that's going to continue to happen. New and emerging diseases are not going to stop anytime soon.
Can you talk a little bit about, would Nebraska Medicine have any role, the biocontainment unit, in responding to this, particularly if it continues to grow?
Angela, why don't you take that as our director of the biocontainment unit?
Sure. So yes, we definitely in the Nebraska Biocontainment Unit follow this and any other outbreak going on in the world very closely. And I do feel like that in our role as a biocontainment unit and also, as one of the leaders in the United States in biocontainment, that we should not only be monitoring this closely, but also serving as an example for others as far as doing appropriate travel screening here at Nebraska Medicine, making sure that when people come to our emergency department or our clinics that we're asking that question, have you traveled somewhere outside the United States? Not necessarily just for this virus that we're discussing, but for other pathogens as well. There are other outbreaks going on in the world as well. But yes, in the biocontainment unit, I do feel like that we should serve in that leadership role and to provide that guidance for others in their infection control management of these type of pathogens.
You talked a little bit about the change in response to these kinds of illnesses as compared to SARS 15 years ago, I suppose. Can you expand on that a little bit and talk about what the global response looks like in terms of containing this type of outbreak and treating it if that's something that's occurring?
Sure. I think overall this response has been much quicker and much more open and transparent than what happened in 2003 with SARS. So SARS was going on, and there were cases that were popping up in hospitals, and transmission was occurring for months before anybody really became aware of it outside of the local endemic region. And then it took quite a while to identify what the virus was and to implement appropriate travel screening and precautions. And by that time, the virus had escaped and was in Hong Kong, was in Singapore, was in Vietnam, ended up in Canada. And so you really had a worldwide outbreak at that point. Hopefully, so far, we seem to have done a much better job of identifying cases and implementing the appropriate public health measures to prevent spread. As I mentioned, the Chinese government has actually been very transparent and open about sharing the status of the outbreak and identified and notified partners in the World Health Organization very quickly. The WHO is apparently meeting to discuss whether this should be declared a public health emergency of international consequence. I think at this point, most experts predict that will not happen, that the WHO will be satisfied with the status of response right now and the fact that this appears to be, so far, relatively confined, except for, a few cases that have kind of gotten out on airplanes. And so I think overall, it does demonstrate that the world has made significant progress in combating these types of emerging disease threats.
And if I could elaborate just a little bit on that, clearly here in the United States, we're being very proactive. So travelers from Wuhan, China are actually being funneled into 5 airports in the U.S. now where they are being screened for any kind of respiratory or febrile illness. If they were discovered, they would be observed carefully in quarantine. Similarly, they're being given information that if they arrive here and then become ill, that they should seek a medical attention and obviously alert medical personnel that they've been potentially exposed in Wuhan. So we're very much ahead of the ball game as opposed to where we were years ago, and are being very proactive with this. Here at Nebraska Medicine, as Dr. Hewlett mentioned, we clearly have already put in travel screening for people coming into our clinics and emergency department. We have the biocontainment unit on alert if we needed them.
One question that we've heard on staff here is people locally have had children or friends or known people who've been diagnosed with coronavirus, and it's confusing to them. They hear the word and they think it's the same thing. Can you explain the differences there?
Yeah, so clearly the coronaviruses are a large family of viruses that cause everything from the common cold, which is what you're referring to more severe lower respiratory tract disease, which is what these newer novel coronaviruses are sometimes associated with. We're particularly concerned with these novel coronaviruses and other coronaviruses sometimes in very immunosuppressed hosts. And so sometimes they can cause more severe disease, even the more common coronaviruses, in our bone marrow transplant patients or somebody who is immunosuppressed or the very young or the very old. So, we do have a wealth of experience with coronaviruses in general and are learning more about this new one as days go by.
You said the biocontainment unit is ready. I mean, would someone with a very severe case of this particular strain of the coronavirus potentially come to the biocontainment unit for treatment or quarantine?
There's a chance that could happen. We, as Dr. Brutt mentioned, we are travel screening, and if we did have a person who presented to our emergency department or to our clinics that had an appropriate travel history and also appropriate symptoms, then we would consider bringing them into the biocontainment unit, mainly for diagnosis and then appropriate monitoring and supportive care. We do serve as a leader both in our region and the United States. There's a chance that if there were a patient that were infected with this illness in our region as well, that we could care for them in the unit also. And we do stand ready for this and any other pathogen.
Last question I think I have is, I know that we don't want to be alarmist because the flu is a larger threat for people here in the U.S., but if people have travel plans to go to some of these locations where the disease has been detected, I mean, what are the symptoms or what should people be aware of? Is there any sort of message of what people should be looking out for?
So the CDC has issued a fairly low-level alert for people traveling to that specific part of China that they should be careful, avoid sick people, just some common sense sort of precautions. Again, the coronaviruses generally cause kind of a febrile flu-like illness, and so it could be easily confused with much more common viruses that we're seeing. And as Dr. Lawler mentioned, I think that it's important for viewers to keep this in perspective, that we currently have widely circulating a virus, influenza, that causes anywhere from 25,000 to 50,000 deaths per year in our country every year. And so we need to be making sure that we're taking appropriate precautions to prevent the spread of those viruses while being on lookout for this novel coronavirus at the same time.
A question from a reporter online asking how, if we are currently working with the CDC and WHO and monitoring or preparing for the coronavirus, does the Global Center for Health Security play a role?
Sure. So the Global Center for Health Security is involved in long-standing programs to help train first responders and other healthcare workers in appropriate infection prevention and control. We work very closely with our biocontainment unit colleagues and also with folks here at the university and at the hospital who are part of the Ebola Treatment and Education Center which is the main resource for training hospitals across the nation in appropriate infection prevention and control. And so, all of those efforts together, really over years, have done a significant amount to increase preparedness in hospitals to manage these types of highly dangerous pathogens. That's another advantage that we have over 2003, is that after Ebola and with the advent of NETEC and other efforts, we've done a much better job of preparing hospitals to manage patients with potentially highly infectious diseases, and that's a real resource that I think could be relied on and will significantly improve our ability to manage an outbreak beyond 1 or 2 patients if that's what occurs.
How is something like this different than an Ebola type situation where you have such high levels of travel as compared to not seeing that as much in Western Africa with Ebola?
Well, China is a very common travel destination, both for business travelers as well as for people going on vacation, and so we don't see quite as much travel to those areas affected by Ebola and the Democratic Republic of Congo, namely currently, as we do to China, which is a very common travel destination. So that is one difference about Ebola versus this outbreak, is that there are a lot more travelers returning to the U.S. and to other places from China than from the affected area in the Congo.
The other thing I would point out is that the lethality of these diseases differ very markedly, with Ebola being associated with a much higher rate of fatality than the coronavirus infection. Currently, we have a handful of deaths due to coronavirus in China. It appears to be less transmissible and less severe, perhaps, than SARS or even MERS. So we have that to our advantage as well.
Is there a way to compare how transmissible this might be compared to the flu that we're experiencing, and how lethal it might be compared to flu? We've had 7 deaths in the area via flu already.
Correct, and that's why I think that it's so important for people to keep those things in perspective, that we're dealing with very minimal risk right now from this coronavirus, where we're dealing with a much higher level of risk from very common viruses that we are used to encountering each and every year.
Anyone have anything else?
Well, that is the end of that, my royal family. And they are downplaying it. And I'm going to show y'all what's going on. So, let's get into this next video. Gonna jump right into it. Then I have one more that I'm gonna show y'all. Take this down. Check this out.
We begin with the major new developments in China's coronavirus outbreak. 2 major cities are now under lockdown as China races to contain the mysterious illness that has killed at least 17 people. Another city is shutting down all their train stations.
Quarantine orders affect more than 18 million Chinese citizens. The virus has infected nearly 600 people in at least 6 countries, including the U.S., where a second possible case was reported overnight in Los Angeles. Remy Inocencio is in Beijing. He left Wuhan, the epicenter of this outbreak, just before they closed off the city. Remy, what about the one confirmed U.S. victim?
Good morning. That's right. Health officials in Washington state say that man flew here to China, to Wuhan province, visited, and then flew back home. Now, airport screenings, those have become stronger since then. Take a look at this video, because you can actually see our own CBS News team landing back in Beijing from Wuhan ourselves, and then getting temperature checked by officials right off the plane. Such interesting stuff there, but critics, they're now saying that China's move to try to isolate nearly 20 million people may just be too late. Disinfection point.
This was a scene inside Wuhan's international airport yesterday. Just before we boarded our flight, you could see nearly every person wearing a mask in the terminal. But today, it'll look more like a ghost town, along with the main train station. Wuhan's 11 million people are being told they can't leave, a major step in the city's and country's fight against this virus.
We stress to them by having a strong action, not only they will control the outbreak in their country, but they will also minimize the chances of this outbreak spreading internationally.
That follows several global health guidelines Wuhan is enacting. Doctors covered head to toe, and a quarantine of Ground Zero we visited before leaving.
It's closed and shuttered now, and there's a heavy security presence. We got out earlier to take a look, and an officer really yelled at us to leave.
In the U.S., the country's first infected patient is recovering at a Washington hospital. Health officials say he's in good condition, but concerned about his contact with others.
As of now, there are at least 16 identified close contacts. Local health departments started reaching out to them yesterday.
Dr. George Diaz admitted him to the hospital Monday night. He spoke to our Carter Evans about how they're treating him.
The robot that we're using has access to a special stethoscope, which lets me listen to the patient's lungs, heart, etc., and do an exam.
And the World Health Organization reconvenes today to decide whether to call this epidemic a global health emergency. But looking ahead, it's unsure what really is going to happen because these are just early days yet for what could be a global crisis. Tony?
Yeah, and for scale there, that city in China is about the size of New York City, where the restrictions are now taking place. Remy Inocencio for us in Beijing. Remy, thank you very much.
Well, they have already taken it there, my royal family. Let me look on my other computer real quick. Let me tell you what they said about that. They took it to let's see here. Yeah, here it is. Let me, because I think it's very necessary for the royal family to know what is going on. And let me see here. So the CDC issued a level 3 health warning for the coronavirus. Yes, that ain't no joke. They done took it to a level 3, and I don't know how many levels that it go, but you know, the higher the level. Let's see here. Now they talking about they made a mistake and that the travel advisory remains at a 2. Y'all always worried about fucking money and stuff. That's what they worried about, some damn money. This stuff is serious. Let me email myself this video. It's that one video that I'm gonna send it myself, and I want the royal family to listen to this video. They downplaying it, but you know, we know what we seeing with our own eyes. See, these people be making these damn business decisions, you know, and gambling with people's health because they worried about their coins. And what I was thinking about was that for the Asian race, this is their new year coming up. Gun Yoi Fat Choi, that's what they say. And, you know, that's a big holiday for them. And what I was thinking was, I was like, damn, Esau's new year comes in, and it don't even seem like a new year, what they've been going through for the last 23 days. It's a lot going on with them. Well, look how the new year has arrived for the Asian race. So, let's listen to this, because you can see here what I just read, that the Center of Disease Control and Prevention on Thursday escalated health warning to a level 3 as the coronavirus continues to spread, recommending that people avoid non-essential travels to Wuhan, China. The State Department retaliated and it's level 2 travel advisory, which urge people to exercise caution if traveling to an affected area. That's serious shit. That ain't nothing to play with. So let's listen to this guy. I had listened to him earlier.
Doctor, thank you very much for joining us this morning. How serious is this?
It's really early days in this epidemic. We're seeing hundreds of cases, more than a dozen deaths, spread within healthcare facilities, spread to multiple countries. So it's quite concerning. But there are two key things that we don't yet fully understand. First, how contagious is it? And second, how deadly is it? If you look at coronaviruses, they range from causing something like the common cold to something as deadly as SARS. And we just don't know yet where this one fits on that spectrum.
So, doctor, if that's the case, liken it. How much of a blueprint can we use in the recent instances over the past 20 years for things like SARS or Ebola? Are those the right strategies? Can we use those as roadmaps to tackle what we need to do with this particular coronavirus in Wuhan?
There are a few things that we know rock solid need to be done. First, we need to get more information, have a sense of how many total cases there are, how they've been spreading, and what the risk factors or the things that make it more risky for people, older, underlying conditions, healthcare workers, so we can understand more about how it's spreading, who it's spreading to, so we can help stop it. Second, there are really important things that individuals can do that can make a big difference. First off, simply wash your hands regularly. Second, cover your mouth and nose when you cough or sneeze. And third, if you're sick, don't go out. For Wuhan specifically, and any other place where this virus begins spreading, because it is likely to spread to more countries and more places, it's important to restrict travel there, particularly for people who are elderly or who have underlying health conditions and might be severely ill if they became infected.
All right, and doctor, before we let you go, we know that during the recent Ebola outbreak, there was a fairly large mobilization of the biotech and drug pharma community to try to find ways to cure or create vaccines for it. How closely will U.S. regulators be working with companies on that front? We do know that Moderna already said that they're working with regulators on trying to come up with a vaccine.
There's some products that make a big difference. One of them is simply face masks. This is very important for anyone who's not feeling well to wear. It's a common cultural trend in Asia to see people with face masks if they're not feeling well. And the studies, rigorous scientific studies that have been done, suggest that that does actually reduce the spread of disease. So it's a habit that might spread. But in terms of either a vaccine or treatment, these are probably a ways away. And it's early days yet to understand how likely it is that this is going to be an effective means to curtail this outbreak.
I don't care what anybody say. These people is putting this shit out. Y'all was experimenting on folks, you know. I don't care what anybody say. You know, that's how I'm gonna take it. So, one more thing. So I seen this here with the symptoms: fever, chest pain, chills, rapid heartbeat. Let's blow this up. Difficulties breathing, pneumonia, kidney failure, headache, sore throat, cough, shortness of breath. Take nothing light, my royal family. Don't take nothing light. If you go to the emergency, whatever you go to the emergency for, you demand that you get treated properly. Remember, they work for you. Cause see, we'll go to the doctor and shit and get quiet. You have to advocate for yourself or bring someone to advocate for you. And it's better, because I have a good friend that she's single. Anytime she has surgeries or anything, I am there from the beginning to the end to advocate for her. And I know her medical history pretty good. And I learned it from, believe it or not, of all peoples, Maria Shriver's, Arnold Schwarzenegger's ex-wife, a Kennedy. And she was saying that her mother wasn't getting the best of care. And when she found out what was going on, she started advocating for her mother, There's many other doctors. You can fire them like you can fire a lawyer and keep it moving. But let's not take this light. Keep your immune system built up. And if you want to know some of the things that I take, Lisa Cabrera take, Linus take, it's a couple of my subs, you know who y'all are, that we take. You can come to behind the scenes, and I can tell you something that your whole family can drink immediately to keep your immune system built up, and it works fast. So make sure these Royal Babies' hands and all of our hands are clean and all of this type of stuff. This is a modern day plague at the end of the day, and like I said, the enemy putting this shit out. I don't care what anybody say. I don't trust them at all. So anyway, my royal family, render your voice with your beautiful divine words. And as always, my royal family, I thank you for your love. I thank you for your support. And with that said, Ashe.